Hey guys, today I wanted to present you the study of Hevia Larrain et al. 2021, high protein plant-based diet versus a protein-matched omnivorous diet to support resistance training adaptations, a comparison between habitual vegans and omnivores. So my name is Marius Widerer, and I wanted to talk about the study of Hevia Larrain, and as the title presents, they research about two types of diets compared to a resistance training program and the muscle adaptations because of the diet, of the high protein diet. The two diet types are vegans and omnivores. So they consume a high protein diet, and yeah. The table of content I wanted to present you that you know about what I'm going to talk about and what the study is talking about. So, first of all, I wanted to introduce the title I presented earlier, and after that, I wanted to, um, yeah, after the introduction about research gap, about the hypothesis the authors created and or suggested, I wanted to present the sample which they choose or which they selected to prove their hypothesis. And then out of the sample, I'm going to talk about how the participants get measured, the methodologies. So what is going to measure, what the authors measured, and what the sample did. Because if we don't know what the sample did, we have nothing to measure. So the interventional design will be presented. After I presented the study design, I will continue to present the results and the findings of the authors, and then next to that, I will discuss about the strength and limitations the authors mentioned themselves, and what I see in this study. And in the end, I will conclude the findings of the authors and what we can take home out of the study, and I will conclude what we can do for further research. So, first of all, as I said, I wanted to introduce you what the authors did. So, and why did the author? The most important, if we're talking about research, it's what is the research gap? What is the reason for this research? So, as the authors presented, um, as no long-term studies have been conducted to investigate if difference in the acute anabolic response as a function of protein source would actually translate into distinct muscle adaptation. To date, no study has addressed the effects of an exclusive plant-based protein diet on the chronic adaptive response to exercise. So, out of these two quotes, we can explain the research gap. As the researchers presented at the time of 2021, no long-term studies. So no long-term studies have been conducted to investigate. So as this, the author said, okay, we need a long-term study about getting fines, a longitudinal study. And in the end, they presented no study has addressed exclusively plant-based protein diet. So they compared what is the difference of the protein resource of the protein source. So because of that, they developed a study design. No long-term studies were given. That's why they choose a 12-week experimental parallel group intervention study design. The parallel group is, as I presented earlier, they are no exclusively plant-based studies, plant-based high-protein diet studies, and that's why they designed the study like that. They have one group, the first parallel group, plant-based high-protein diet consumption, and then the omnivorous high-protein diet consumption. The authors hypothesized that an exclusively consumption of plant-based dietary protein would be less effective in supporting resistance-induced muscle adaptations than an omnivorous diet. So, just to summarize it, the authors did a parallel group study design because of the research gap. a 12-week intervention, and they hypothesized that the plant-based dietary are less effective compared to resistance training in muscle adaptations than omnivorous diet out of the known literature. The sample they choose for that were males. So in their inclusion criteria, they wanted to research males, young, healthy males, and these were the inclusion criteria. So they said the participants has to be physically active without resistance training for at least 1 year. So that means the participants are untrained. They need to be absent of any chronic problems. That means, okay, they are healthy, and they need to have an habitual protein consumption of minimum 0.8 gram per kilo body weight per day. And they need to consume, or they need to do a plant-based or omnivorous diet for at least 1 year. So that's nothing new, that they are like familiar with this diet form. Out of this criteria, they assess for eligibility 308 people. Next to that, they excluded some of them because of their exclusion criteria. And yeah, that was the exclusion criteria were using of anabolic steroids. So the participants were not allowed to use anabolic steroids. And they need to, that they are not current or previous less than 3 months use of ergogenic protein-based supplements. The same for current and previous than less than a year engage in energy restricted diets. So in the end, out of the inclusion criteria and the exclusion criteria, they created the two parallel groups out of the sample size of 23 per group. So in summary, they included 46 participants for this study. After the allocation, they did the intervention and how they follow up. And in the end, for each group, 4 participants discontinued the intervention. So in the end, they could analysis like 19 participants for each group. So in the end, the analyzed sample was like 38 people. So as I mentioned earlier, they choose males for their sample, and the age was in mean 26. So the youngest ones were 21, and the oldest one were 31. So as we can see here, they created a table where the characteristics of the participants were shown. As you can see here, body weight, height, BMI, whole body lean mass, leg lean mass, leg press, total serum, ferritin, vitamin B12, and so on and so on. To explain why there is mentioned vitamin B12 and ferritin and 25-OHD, it's because of the known literature. It's presented in the literature that plant-based diets have less vitamin B12 and less ferritin, and that's why this could influence the results of this study. That's why they mentioned it and measured it before. So, as I presented before, there were like for the study sample, they show the leg lean mass. And why they show the leg lean mass? It's because of the intervention. The intervention was that they have a 12-week intervention, and they have a protein intake in this 12 weeks with 1.6 gram protein per kilo per day. So every day the participants, the included 38 participants, consumed this number of protein. The supplementation was for the vegans, was an vegan-based protein supplement, and for the omnivorous, it was on whey normal milk weight. And they consume this twice daily to save that they are taking in the 1.6 gram protein per kilo per day. So next to that, in these 12 weeks, they did a resistance training program 2 times per week at non-consecutive days. For example, Tuesday and Thursday, or Tuesday and Friday, but not on consecutive days. They did it every time at the same, or they have 2 time slots on the days they did it at 11 a.m. or 5 p.m. before lunch and before dinner, because after that they consumed proteins, the supplements, and the normal proteins, and that's why they choose this time slot. The resistance training program was structured like that. They had a warm up every time, a warm up like 5 minutes of cycling ergometer and 2 sets of leg press, 8 repetitions of 50% maximum, and 30%, 3 times of 70% maximum. The intervention setting was that they performed leg press 45 degrees and leg extension with 2 minutes of rest between the sets. The first 4 weeks, they performed 2 sets with 12 till 15 repetitions maximum for these 2 exercises. The weeks 5 till 8, they did 3 sets with 10 till 12 repetitions maximum, and the last 4 weeks they did 4 sets with 8 till 10 repetition maximum. If they performed in the sets more than one or two repetitions more than the maximum, the resistance increased by the time. That's what the authors mentioned. So this was the intervention and study for the sample. As I mentioned before, some things were measured before. For example, vitamin B12. So before the intervention started, the 12-week intervention started, the authors or the researchers did a blood sample. So they wanted to see, okay, how is the blood sample of the 1 year vegans and 1 year omnivores. They did a dietary assessment. That means before the intervention, they did dietary recalls, 24 hours that the individuals needed to do this recall, that the authors get information about, okay, what is the habitual protein consumption and how they save it. So this, they do it in the intervention time too. They did a DXA and dual energy X-ray epsiterimetry for the structure of the bones, muscle cross-sectional area assessment, and a muscle biopsy to assess the fiber cross-sectional area. They did a lower limb maximal isotonic strength test. That's because of the interventional setting, because of the exercise which were performed. And in the end, when they got the results, the pre-test and the post-test, they statistical analyzed them. So the experimental design, as I told you, they did a blood sample, they did a dietary recall, they did a DXA, and muscle cross-sectional area, muscle biopsy, and 1 repetition maximum 1 or 2 weeks before the intervention starts. When the intervention starts, they did no of them of these measurements or methodologicals except the dietary recalls. They did it in week 4 and week 8. And after the intervention, they did this again, and they did all of the measurements again without the blood sample. So out of this experiment design, they got these results. So in every time you see here, the blue ones are the vegans, the white one are the omnivores, and the cross. So the cross is like the mean of each group. And as you can see, you see the pre-test and the post-test, and everything increased. The leg press, 1 repetition maximum increased. The leg lean mass increased. The vastus lateralis muscle cross-sectional area increased. The vastus lateralis type 2 for fiber cross-sectional area increased. So everything increased, and the authors mentioned that there were no significant difference between the plant-based and the omnivorous diet. That's why they thought about, okay, what is the limitation? Why is this result given, or why not? Because there's no significant difference shown, but it's shown that the high protein consumption um, increases the muscle hypertrophy or the muscle adaptation. So they were thinking about limitations and strengths. They mentioned that they have a lack of randomization in the sample size. As we see it, as I presented, of course, there was not that much randomization. They didn't mention body weight and anabolic response, and that's why probably systematic errors come. The sample size was not that big because probably of that there come some errors. Because the dietary recalls were did by the individuals themselves, systematic errors were shown. But these are limitations. The strengths of the studies, we have to talk about that, is that their results are comparable to others because they said, okay, their muscle adapts, so they have an increase in all of that. And yeah, they did a long-term intervention, and that was not done before. So no other studies at this time of date researched in the difference protein of the protein source, and they have increasement in the muscle adaptation. That's why they concluded high protein, exclusively plant-based diet is as efficient in supporting muscle strength and mass acquisition in untrained young men who are habitually vegans as a protein content mixed in untrained young men who are habitually omnivorous. So in this case, they did a really good job. Their strength was given. But one thing I wanted to mention is they did a blood sample before the intervention, but not after the intervention. So probably they can do this to look, okay, which micronutrients are missing for the plant-based diet. So then they could discuss about, okay, which one is better, the omnivorous or the plant-based one. But in summary, they find that muscular adaptations are unspecific. The muscular adaptations are given for plant-based diets, high protein plant-based diets, and high protein omnivorous diet. So in summary, their hypothesis was not proven, and the source doesn't matter, but the number of proteins matters. That's comparable to findings before. Thanks for listening. See you.